Yeah, yeah.
There's like 20 of
Meg?
them.
Steve, Dana, Alana, yeah, come on up.
Oh, thanks.
Yeah, and John, of course.
Fine, do you?
Yeah, sure, Dana, sure. Okay. Vast majority. Yeah. Good afternoon, everyone. Thank you for joining us here today to talk about the local EMS crisis and what we can do to rescue local EMS services. I'm Ryan Gregoire, NYSAC's Legislative Director, and I'm honored to be joined by many of our colleagues across the state, including Meg Kennedy, NYSAC Board Member and Vice Chair of the Otsego County Board of Representatives. We have a number of our legislative colleagues who are joining us. Of course, right now we have Assembly Member John McDonald, Assembly Member Billy Jones, Assembly Member Andrew Havy, who's with us, and of course there's others that will be coming down. We also have Alana Badgley, the co-founder of the EMS Sustainability Alliance and Make EMS Essential. Steve Kroll, the legislative chair of the New York State Volunteer Ambulance and Rescue Association, NYSVARA. John D'Alessandro, the executive committee secretary for the Firefighters Association of New York, FASNY. And many other advocates, including representatives from NYSVARA, Onion, FASNY, and I should also note that we have Dana Smith from Dutchess County. He is the Commissioner of Emergency Services and representing the 911 coordinators. Oh, and then we've also been joined by Assembly Member Dee Barrett and Donnaardo. So we're here today because local EMS in parts of our state is in crisis due to rising costs and high demand for increasingly complex services. Ambulance wait times are getting longer and longer, and a lack of volunteers and funding shortfalls have thrown our EMS system into crisis. At NYSAC, our mission has always been to foster excellence in county government and unite the county voice. That's what we're doing here today. We've heard the county concerns from across the state, and we've worked with our partners in the legislature and across the EMS industry, many of whom are with us here today, to develop a package of legislation that addresses challenges facing EMS and provides counties with the resources and flexibility they need to ensure their residents have reliable access to these life-saving services. Before I turn it over to the rest of our speakers, I want to thank each and every one of them for working with NYSAC over the last year and a half to develop this package of legislation, and I commend them for their leadership on the issue. I also want to take a moment to thank Governor Hochul for including some of these recommendations in her budget proposal. We look forward to working with her throughout the budget and session to get those items and the rest of this package enacted into law. Now, a bit of housekeeping real quick. We do have a press release that's available on our website, and after we hear from all of our speakers, we will then go to Q&A. So at this point, I also want to recognize Senator Michelle Heni, Senator Monica Martinez, who have joined us. We're going to go to Meg Kennedy, Otsego County Board Member and member of the NYSAC Board of Directors, first to say a few words. Meg?
Thank you, Ryan. Thank you, Ryan. Thank you to Senator Mayer and Assembly Member Lupardo who have invited us here today. Also, thanks and welcome to the Assembly and Senate members who are with us and fellow county leaders who are here today. It is an honor to join with you this afternoon. Our gathering today at the beginning of the legislative session emphasizes our commitment to assisting EMS across the state. We are familiar with the challenges. Ryan named many of them. Significant wait times for ambulance services. We're familiar with the budget questions. How do we pay for multiple ambulances, personnel, administration? We have a 2% tax cap to keep in mind. And we have local agencies that we rely on and value as partners in this process. We need this. In 2021, Otsego County committed to providing countywide ambulance service. We are paying for it, but there's always the question people ask, Meg, how are you going to pay for this? And how is that going to affect me and my tax bill? So we've doubled in size since we put wheels up down 2 years ago. But now we have new statistics that we're dealing with, and they're all on the good side. Thousands of calls, better response times, and behind every statistic there's an individual drama. Some of them are sensational, life-saving stories, and some are just routine calls where the EMTs showed up and maybe jumped a battery and sent the people to the hospital on their own. So everything in between. But we are making a difference, and that service is saving lives. The countywide service has become an essential part of life in Otsego County. We're tasked with balancing the budget for a service that we know is still in the growth stage. Across the state, especially in the rural counties, where our population is spread out over our rolling and abundant farmland, county leaders are sitting down and finding themselves somewhere on the road to where do we jump in and help these volunteer agencies who are providing a response? How do we help? The 6 proposed bills that NYSAC has identified provide relief through a variety of strategies geared to fill the gap in the paying for it part and to incentivize the volunteers who keep the local partner agencies rolling. So thank you for your dedication to EMS across the state. Thank you.
Thank you, Meg. We've also been joined by Senator Shelley Mayer and Senator Rachel May. I think I've got everyone. And Assemblymember Chris Ickes. So at this point, I would like to go to our first 2 event sponsors who have graciously helped us get this event organized. So let me go first to Senator Shelley Mayer.
Thank you very much. Thank you, Ryan. Thank you to all my partners and all of our colleagues from the legislature who are here. I am proud to be a sponsor of one of the bills in this package that is strongly endorsed, S 4020A, 4020B, or is in a big print, because we're working to get it done with my colleague, Assemblymember Steve Otis. And, you know, we represent, both of us, a downstate suburban district on the border of New York City. This is a statewide, in fact, a national issue. This is an issue that requires a tremendous amount of attention and reconfiguring to make it work. And I'm incredibly grateful to Chris Bradbury, the Rye Brook Village Administrator here from my district, who I asked to come. He is the one who came to Steve and I and said, we have a real crisis, a crisis that needs fixing. And the most important thing to the men and women that do this work is that they be called essential providers. They have done the work. They are step up in the incredible risk, and yet they're sort of considered second class to other first providers. And so, having lived through sort of the worst of COVID in the downstate suburbs and New York City, we saw what these people did. No one should underestimate what they did. They went into houses not knowing who was sick. They took people to the hospital not knowing as much about COVID as we know now. They put themselves at grave risk day in and day out through the entire COVID pandemic. And yet we have sort of not treated them well. So our bill, which is a comprehensive approach to both naming them as essential providers, ensuring there are statewide standards, ensuring there's input from these providers and how the standards work, is part of the way of changing the entire way that EMS is provided in New York State, outside of New York City. And it is, as I said, an entire statewide challenge and, frankly, catastrophe. We're so thankful that NYSAC has stepped up to be a tremendous partner in making this a a collective effort on all these bills, and I want to thank my colleagues in the legislature for being there, and I know Steve will be here. But this is not a one-and-done thing. This is a lifelong fight to get EMS the help they need and the service and recognition they need so that it works for all of us. So thank you very much, Ryan, for having me.
Thank you, Senator. Let's now go to Assemblymember Donnaardo.
Thanks a lot. Well, thank you, everybody, and thanks to my colleagues and to NYSAC and others who are here in support of this very important topic. It's somewhat ironic that the legislative package that we're putting together is called Rescuing Local EMS. After all, we have come to rely on EMS to rescue us, and yet we are called upon to rescue them. And we're, for those of you in the social media world, please use the hashtag #RescueEMS. We are building upon the success that we achieved as a group last year by finally getting insurance companies to pay EMS providers directly. This has been an ongoing challenge, and we organize press conferences in an effort across the state to move that one across the finish line, and we want to thank the governor for signing that bill. We also want to thank her for putting this essential service bill into the budget, as well as the issue of treatment in place. So we're definitely making some movement here. I mean, clearly, ambulance service is too important to put at risk in this way. So it is somewhat interesting to me when I talk to my constituents that they are surprised to learn that EMS is not considered an essential service. They view it as important as fire and police. And so when they find this out, they're pretty alarmed, especially in light of funding shortages, long wait times, which they're now starting to experience, and workforce shortages. They want to know what they can do. So this package is designed to address a series of challenges that they face. And we are hoping that by organizing in this way and really highlighting the importance of it, that we'll be able to get a lot of this across the finish line. The actions that we're taking today are designed not just to strengthen local EMS services, but it really is about protecting public health and safety. And as more people learn about the vulnerability of this important service, the more people are committed to, in fact, rescuing EMS. And so we owe it to them to do what we can. My partner in one of the bills is Senator May, and I assume you'll be referencing that bill when she speaks as well. So thanks, everybody.
Thank you, Assemblymember Lepardo. Now let's go to the Hudson Valley. Senator Michelle Heni.
Thank you very much. Thank you, and thank you everyone for being here today. As Ryan said, I represent the Hudson Valley, the 41st District, which spans 4 counties and 56 towns. And one of those counties, in the entirety of the county, we do not have a hospital. And the rest of our district is incredibly rural. And so our EMS providers are critical components to our healthcare system. They are the folks that are quite literally saving lives in the moment before someone may even be able to get to a hospital anywhere or anywhere near one. And so this package is so important. I thank NYSAC, all of our partners and all of our legislative partners for making this such a priority right now. And I do thank the governor. Bringing EMS as an essential service is critical, and I'm excited that we're going to get that done this year. So thank you to my colleagues. Today, if an ambulance crew treats a patient in their home or transports them to another healthcare setting like a mental health facility, they won't get paid. Payment only happens if they take a patient to the hospital ER, even if they've already provided the necessary care, and that needs to change. In the rural communities that I represent, EMS is the front line of healthcare. They are the safety net that people rely on in our medically underserved communities. As I've said, we've seen firsthand how a lack of steady funding, along with workforce and geographic challenges, have pushed EMS providers to the breaking point. It's incumbent that we deliver real solutions, and it's incumbent that we do it this year. 2 years ago, I was really proud to sponsor legislation to create the Rural Ambulance Services Task Force. And today, I'm incredibly proud to sponsor the bill in this package that stems directly from that task force's recommendations. Our bill introduces 3 new funding streams for reimbursement for EMS. Treating patients at the scene of an injury, including in their homes, transporting patients to approved healthcare destinations like mental health facilities or urgent care, and connecting individuals to doctors through telemedicine. This is so essential to help our essential services that are our EMS providers. And so thank you to everyone who is here. I'm really proud to carry this bill, and this package is something that we have to get done. Thank you very much.
Thank you, Senator Heni. Let's now go to Central New York and Senator Rachel May.
Thank you. I mean, first of all, let me just thank everybody here who is working on this issue, because I represent Cayuga County and Onondaga County, and I was having office hours in Cayuga County on Friday. There must have been 20 constituents who were there to talk to me, and fully half of them were either EMS providers or volunteer fire departments that were struggling with their EMS support. So this is an issue on everybody's mind, and it truly is something we all take for granted. We assume that it's essential, but we have to make sure that the state recognizes that it's essential. So thank you to my colleagues for bringing those bills forward. I also have a bill with Assemblymember Lupardo that would remove EMS services from the real property tax cap. We shouldn't be creating disincentives for local governments to fund EMS through this tax cap system that we have. So this is kind of an obvious one to make sure that they can do that work. Another thing that was recommended to me that isn't in this package, but that I heard about, was the critical care certification that the state is phasing out. Some of the EMS providers in my district, 3/4 of their workforce has that critical care designation, and they didn't say the state shouldn't phase it out. They just said they shouldn't phase it out while there are still people in the workforce who have that certification, because they don't have anyone else stepping up to do that work. So that's something we can work on, I think, in the future. But just in general, I want to say EMS is in crisis, and I hear about it almost every day in my district, and I'm so grateful to all of the legislators on both sides of the aisle who recognize this and are stepping up to make a difference. Thank you so much.
Thank you, Senator May. Let's go to Long Island now, and Senator Monica Martinez.
Good afternoon. For those of you who do not know, the area I represent, Suffolk County District 4, encompasses 2 townships, but a lot of EMS fire departments as well. And from what we just heard from our colleagues, and I want to thank Senator Mayer and Assemblywoman Lupardo and NYSAC for really bringing this together and shining this light that we need to rescue our EMS and to prevent them literally from flatlining. Right, if you want to start using hashtags, right? But these are services that are provided to our residents on a daily basis, and they need our help. On Long Island, and I'm sure it's across the state, one of the issues that we're facing is not only recruitment, but retention. We need to give incentives for these individuals who want to really help their communities be able to go and stay. And I am proud to carry a bill that would do just that. And it's just one incentive of so many incentives. And this is Senate Bill 7286, which would propose the increase of a personal income tax credit from $200 to $800 for individuals who are eligible. And if you are eligible, married joint filers from $400 to $1,600. We need to find ways to incentivize the industry. I also see we have our 911 operators here. Let's not forget about them too, because they're the first ones to get the calls before our EMS go out there as well. And we need to really make sure that we are investing in our EMS services. And one thing that we can all agree on, aside from the retention and the recruitment and retention, is the fact that we need to invest in our EMS services. They need to be up to date with their trucks, their ambulances, the advanced support systems that they all have. And if we don't do our job as elected officials, then I don't know what we're doing here. But I thank the governor for putting this in her executive budget, but you can rest assured that both houses will be working really hard to get every single one of these measures passed in this legislative session. Thank you.
Thank you, Senator. Let's go to Dutchess and Columbia County Assembly Member Dee Dee Barrett.
I heard my turf mentioned. Thank you, Ryan, and thank all of you for being here. Thank you to my colleagues, and thank NYSAC for really leading the charge and bringing us together on these issues. As long as I've been in office, which is now 12 years, it has been so clear to me that rural communities like those that I represent are somehow ignored when we talk about healthcare, and we talk about so many actually services that are commonplace in urban settings and even in suburban settings, but are really not necessarily getting the full opportunities in our rural areas. And so having this conversation from our colleagues in New York City and Westchester, all the way in Long Island, all the way through, and recognizing that this is a state of New York issue. We know that there is more to New York State than that city of 1 million people or more. So I want to be sure that we all recognize the importance of the work that these volunteers, and in my district, it's almost all volunteers that are our firefighters and our EMS workers. I have 42 fire companies in the 2 counties that I represent. That's a lot of people who we need to both recruit and retain. And as Senator Martinez said, we need to create incentives. So our legislation, my bill, which I carry with Senator Mannion, is to be sure that people who take the tax credit that we give and have given, which is a couple $100 for EMS workers and volunteers, can also access the property tax the credits that we recently passed in the last couple of years. And at the moment, they can't. So in order to be able to take that deduction and get the tax credit, we need to pass this bill and make it with the rest of the bills that we're passing in this session to get this done for our first responders across the state of New York. So thank you.
Thank you, Assemblymember Barrett. We'll now hear from the Capital District, Assemblymember John McDonald.
Thank you, Ryan. It's great to be here with my colleagues in elected office, but more importantly, to those first responders, the people who actually do the work, the people we hear from. And I want to thank NYSAC for coordinating this. We talked earlier, is this really their mission? It is when it comes to human services and public safety. I want to highlight 2 bills of this package. And by the way, this package is unique. It's not all about money, to be honest with you. It's about removing barriers, and 2 bills in particular remove barriers. The Otis Mayor bill, which talks about creating EMS as an essential service, removes barriers. It allows local governments to work together to either provide or enhance the service. I know here in Albany County, southern part of Albany County last year, it was a major issue as these entities wanted to come together, but as we researched the laws, we realized it wasn't going to happen. The other item in removing barriers is regards to treat and place by Senator Heni and Member Kellis. Now, I was a former mayor for 13 years. I went on a lot of EMS calls. I'm also a healthcare professional. I see what goes on. Many individuals who could have been treated in their residence and prevented a trip to the emergency room could have gotten care. Technology is a great thing. We adopt it, we embrace it. The telemedicine component, particularly in the bill, is critical because I know individuals, if they've got a doctor or a nurse practitioner or a PA on the other end of the line, are going to be more comfortable with the recommendation that, you know what, you're fine, let's get the medicine that you need, you don't need to go to the ER. And by the way, when we're talking about our healthcare system in general, our hospitals and ERs are struggling because of the term of throughput. Throughput is getting people through the system. If we can control and slow down the number of people going into the ER, we are actually doing our hospitals and our whole healthcare ecosystem a huge favor. And by the way, why this is in the budget is because it's actually going to save on overall cost of care to the payers and to the state. So it's great to be here. I thank, once again, the Association of Counties for bringing this all together. Thank you.
Thank you, Assemblymember McDonald. I want to go to our friends in New York City because NYSAC, of course, represents all 62 counties. And let's hear from Assemblymember Havy from Queens County.
No applause for the city of New York? Seriously? What is with this crowd? There we go. All right, now I feel better. Good day. Thank you. My name is Andy Havy. I'm a member of the legislature now for 19 years. I'm honored to be on this panel with all of my colleagues. Thank you to NYSAC. Thank you particularly to Shelley Mayer, who I love in the Senate. I loved her a little more when she was in the Assembly. And Donna Lupardo are great leaders. My contribution is there was a bill carried by former chairman of the Health Committee, Richard Gottfried, that provided for a proper Medicaid reimbursement for EMS. So when they are called out and taking care of a Medicaid patient, that doesn't do a financial disservice for the EMS operations that are crucially important to save lives throughout the state. I am honored to be a part of this team, and I want to thank everybody for allowing me to be here today. Thank you very much.
Okay, let us now go to the southern tier, Tompkins County and Cortland County, Assemblymember Anna Kellis.
Thank you so much. I mean, we've only known each other for like a decade. I actually came from county government, so this is a topic near and dear to my heart because we spent the 5 years that I was in county government working on this issue. Tompkins County has some of the worst response times in the state and in the country. We have some response times that are about 25 minutes in some areas. The national average is about 4 minutes. Just to give a sense, we know that you can have permanent brain damage with lack of oxygen to the brain after 5 minutes. So just giving people a sense of how phenomenally important EMS services are and how far we are from where we need to be. And I want to thank everybody who here, all of my colleagues, because everyone here knows that the package that we have put together needs to be that. It needs to be a package. There is no one solution to this problem because EMS is very complicated. We have for-profits, we have not-for-profits, we have community-based EMS services. We have government-based EMS services, some that are in fire departments, some that are separate EMS departments within a community. All of them have different challenges, and many of them have volunteers. There are some, of course, in my district and many of our districts, they're completely volunteer. And we all of us have experienced, right? We've had a cost of living that has been continuously escalating, and we've had flatline incomes for many decades, and we are still holding an entire industry up on the backs of people who are volunteering all of their time. They're paying for their own training. They're paying for their own equipment. That's what we're all acknowledging here, saying that we cannot do that anymore. We have got to create a solution that uplifts a very community that is literally keeping us alive as a community. That's the baseline that we're saying. So yes, funding, Medicaid reimbursement rate increases. We absolutely cannot have this being part of the tax cap. Like that's crazy, right? So the Medicaid reimbursement rate increase cap. I mean, those are things that are antiquated. They're causing problems. We are standing in our own way. I do want to just second what John McDonald was saying, Assembly member. It is so incredibly critical that we give flexibility for our EMS providers. They are the experts. So why are we holding them back in being able to assess a situation and decide whether or not they treat in place or whether or not they bring someone to a hospital? That should be it within their purview. And if they can treat in place, they treat in place, and then they are immediately available for the next person that needs them. And that's part of the reason that we have this lag in availability of EMS services. So important that they can treat in place. The second piece of this that is so important, of course, is that they can bring the person that they have picked up, that they're bringing to a facility, to alternate locations. Why is that the case? Because if you can only bring to one location, to a hospital, and the hospital beds in the ER are full, then the EMS vehicle cannot leave. It cannot leave until a bed is emptied. They can remove the person from the EMS vehicle, and then they can go back on the road. So again, we are holding them for what purpose? For what reason? Are they not the experts? Should we not be listening to what they're telling us they need to provide us the service that we so dearly need for everyone and for the foundation of healthcare? Let's not kid ourselves. EMS is the first line of healthcare. It is no longer simply transportation. It is the first line of healthcare. These are healthcare providers. We should be supporting them as such with the funding and with the flexibility they need. Thank you all so much for being here. This is wonderful. And thank you, Ryan, for bringing us all together.
Thank you. Thank you. Thank you, Assemblymember Kellis. Let's stay on the west side of the Hudson River, and we'll go to Orange County and Rockland County. Assemblymember Chris Ekus.
Thank you, Ryan, and thank NYSAC. Certainly one of the most important things is making EMS essential. There is no question about that. But I also have a bill put forth because I'm not sure people are aware, but if the fire departments or the police respond to an accident or an incident on the thruway, they are not charged. EMS is charged to go on the thruway. Now, they can get their money back. They can apply to get their money back. But we're talking about shortages already of people, shortages of volunteers, and to have to take the time to apply for that money, to get that money back, is an absurdity. So my bill takes, and by the way, if they go through a crash gate to respond to an accident, they get charged for the entire length of the thruway. So my bill takes, and it gives the EMS, all EMS vehicles, the same pass that the police have and that the fire departments have, so that they will not be charged. They then don't have to wait to get their money back. They don't have to take the time to apply for it. And it is definitely, as mentioned by Assemblyman Havy, it's one of those barriers, just another one of those barriers that we need to take out of the way of the EMS. So thank you very much.
That'll be in the package. I want to now go back over to the east side of the river to Westchester County, Assemblyman Steve Otis.
Thank you, Ryan. Through powers of clairvoyance, I'm going to try and not repeat anything that anyone has said. But I'd say this, that you know about the crisis, but what is very interesting is from all around the state, different kinds of EMS organizations, units, local governments have come together to say, we have to do something. We have to provide a unified response and reforms to make sure that people get the response time and the service that they need when there's a crisis. So that's the mission that we all share. You let me know if anyone said that before I got here, but let's keep up the work. We got to get these things passed this year. Thank you.
All right, I think we've pretty much heard from every county region across the state. Before we go to questions, I'll just turn it over to our other colleagues, our partners here who've joined us. Would anyone else like to say a few words before? Yeah, okay. Steve, Alana? Yeah, okay. Steve Kroll, Legislative Chair, NYSAC.
So, Assemblyman Otis, I was great on what I was going to say, but you got it for me. So I was almost there. I'm Steve Kroll from the New York State Volunteer Ambulance and Rescue Association. I'm the chief of Delmar Bethlehem EMS here in Albany County. We're a not-for-profit ambulance service that makes up, has about 60 volunteers that put in 15,000 hours a year of service, and then a career staff that supplements them. I want to talk about unity today. We are a field united. I want to thank NYSAC and Ryan for bringing us all together. I want to thank all of our incredible legislative colleagues who've put together this package of bills. I want to thank, as Senator Mayer said, the governor has put some of this in the executive budget. And so let me share a few statistics with you. There are about 980 ambulance services in the state of New York. A little more than 50% of them are not-for-profit, like mine. About 10% of them are commercial businesses, but they answer half of the emergency calls in the state. They're larger businesses, and they're here with us today. About a third of them are fire-based ambulance services, and they're with us today. The entire field is united with state legislature, counties, local government, and all of the EMS providers. And I'll share a couple statistics with you. The number of certified emergency medical responders in New York State has dropped by 17.5% between 2019 and 2021. So our field is, for all the reasons the legislators talked about, is in trouble. We have to fix that. We have to turn this around. The second fact I'll share with you is we're paid roughly 2/3 of what it costs every time we transport a person who is a recipient of Medicaid. So that means essentially these local ambulance services are subsidizing the service for the Medicaid program. And we're particularly grateful to Assemblymember Havy for his bill on that. And also Senator Heni talked about the treat and place and treatment transport to alternate destinations. We can help people get better care closer to home, not going to the hospital where they have to wait in line for a long time, by treating them in place, by working with telemedicine. So I want to thank everybody up here who is representing everybody together, and it looks like it's going to be a great year for us to get this done in the legislature.
Thank you, Steve. We'll go over to Alana Badgley now from the EMS Sustainability Coalition.
Hi, everyone. My name is Alana Badgley. I am an active duty paramedic here in the state of New York. I'm also the president of the International Association of EMTs and Paramedics, Local 20 Union, and now the president of the EMS Sustainability Alliance, which is overseeing the campaign to make EMS essential. A lot has been said, but I want to touch briefly on provider mental health. Often when we talk about provider mental health and EMS mental health, we talk about perhaps the disproportionate rate of suicide within our community and that of other first responders. We talk about critical incidents such as pediatric calls or mass casualty incidents. What we don't talk about is the moral injury that we feel when we hear somebody calling for help and no ambulance responding to them on the other side of the county. Every single day in every part of this state, we are, as the providers, hearing those calls going out and hearing those calls either going unanswered or taking way too long to be answered. That's happening in the urban areas. Perhaps I'm down the block from the call, but I still have a patient on the stretcher and I'm waiting for triage in an overburdened emergency room. And it's happening in rural areas where maybe there just aren't the personnel there and ready and available to be able to respond to that call. The EMS Sustainability Alliance grew out of that heartache, grew from that moral injury that we as providers feel when we hear somebody not getting the help that they need. We all got into this field because we care, because we want to be able to provide high quality pre-hospital medicine to our neighbors and to our communities. And so we have formed this coalition from all around the state. We are all different. Some of us are volunteers, some of us are educators, some of us are concerned citizens, and we all are coming together, just like the group here, to solve this crisis because it does hurt. So we respond to your chest pain calls and to your heart attacks. And what's happening right now and what is so encouraging to us and what we are so grateful for is the fact that all of the legislators that are standing here are responding to our heartache. And passing this package of bills this year is supporting the mental health of the providers that are out in the field. So I just want to kind of land on that because it was something that hadn't been said and just needs to be known that we care. We care deeply. And so thank you all for what you're doing to help support us. Thank you.
Thank you, Alana. Yeah, okay. Let me not forget our partners in all of this, the Firefighters Association of the State of New York. John?
Thank you. Despite what you might infer from our name, we do represent the volunteer EMS responders in the state. We understand, perhaps better than anyone, what kind of a crisis that we're in, both on the fire and the EMS side, because we're the ones that are tasked with showing up on people's doorsteps every day, 24 hours a day. I hate to be the bearer of bad news, but we are in a fire and EMS response crisis in the state of New York. We are in that crisis because of financial issues. We are also in that crisis because of personnel issues. So anything that the Firefighters Association can do to support the efforts of the legislators here today, these legislative initiatives, the initiatives that the governor has outlined in her budget and State of the State messages, and what NYSAC is doing. We are full partners, because I can tell you without a doubt, being a first responder, we should not be spending an inordinate amount of our energy trying to figure out how to be financially viable, or our efforts to make sure that there's enough first responders that takes away from our mission. We all join this, as you heard from the last speaker, to help people. And when our attention and efforts and energy are taken away from that mission and have to look at financial and manpower issues, it compromises that mission. So I look forward to all of these initiatives becoming law and being put into effect as soon as possible. Thank you.
Thank you, John. And our last speaker for today, we're going to go to our other partners in local government, a member of NYCOM, Chris Bradbury, Village Administrator, Rybrook.
Thank you so much. And thank you so much for all the support of NYSAC and all our legislators. EMS is in such a crisis mode. They've always been there for us, and it's time for us to be there for them. It's amazing how this issue is affecting so many people, yet so many people don't know about it. The average person doesn't realize that it's not an essential service. And what does that mean? I don't know if we keep saying essential service. If it's not an essential service, it means it's not required to be provided. Imagine calling 911 and saying it's either not available or you're going to have to wait an hour and a half for the nearest agency to be able to travel there. The volunteers that respond, some of them that means they're traveling greater distances. Because of the issues in the hospitals and their serious issues that they're facing, it could be an hour and a half. You're asking that volunteer to wait to get a bed freed and be able to return back to either the agency or their work or their home. That's affecting them. That's affecting their families. Down in Westchester County, where I am, we're having mutual aid issues where it was taken up to an hour and a half to get a mutual aid call from the agencies. So you're calling and they're getting somebody from across the county calling 14, 15 agencies to be able to find somebody to respond to a call on the other side of the county. That's not acceptable. And we've worked with our county to come up with other solutions to try to address that. And the county has had to hire other agencies to supplement that. So these are serious issues for all of us. It's happening upstate, it's happening downstate, it's happening everywhere throughout, and we need to do something about that. Thank you.
Thank you, Chris. All right. I think we've heard from all of our speakers now. I think everyone has seen the level of interest across the state of New York, the passion that's in this room behind me. To echo the sentiment of everyone, we've got to get this package accomplished and over the finish line. There's no more time to wait. We're in crisis mode. So with that, I think we'll open it up for questions. If anyone has anything, any members of the media have any questions for us? Yes, sir.
Yeah, you say countywide EMS. Is this primarily funding existing organizations and expanding resources for them, or are there any initiatives to create new organizations where there might be gaps?
Great question. So part of Senator Mayer's bill, Assemblymember Otis, and what the governor has put into place would allow at local option the ability to create a joint taxing district. That could be set up at the county level. It could be set up between two towns, between a village and a town. But really what we're seeing across the state, whether it be Otsego County, where Meg Kennedy spoke from, or Greene County in Senator Hinchy's district, the counties are providing ancillary supplemental services to what's existing, what's out there. And one of the things that the legislation will be addressing down the road is ensuring that we are protecting the providers and system in place. So we're not creating a system where we're throwing someone out of the ring. So for example, if you've got a private EMS provider in one part of the county, and then you've got some volunteers and maybe a nonprofit sprinkled elsewhere, the county's not coming in to take over and kick everyone out. We're looking to just supplement services that are not maybe in one geographic location or another. Anything else? All right. Well, thank you all for coming. Thank you.
I ran like a banshee to get